Hi, my name is Emily. Today we're going to be talking about anti-aging, specifically fine lines and wrinkles. I work at the Cary location. I am one of the estheticians and laser specialists here. We're also going to be talking about neurotoxins from our expert injectors. Microneedling is a go-to recommendation of mine for those clients who want to start the collagen induction therapy. Collagen induction therapy helps rebuild from the inside out, smoothing fine lines and wrinkles while also plumping the skin. Microneedling creates an injury to the skin by using needles. By creating this injury, your body has to heal itself, and by healing itself, it produces collagen. We have a couple of different options for microneedling. We have our standard microneedling and then our RF microneedling. RF microneedling is great for those clients who are looking for something a little more corrective. RF microneedling is radiofrequency microneedling. It uses heat and energy. Using heat and energy actually creates a lift in the skin, which results in a better anti-aging response. By combining heat and energy along with collagen induction, you're able to achieve a more powerful result. We are so excited to announce that we now have salmon DNA that we can pair with microneedling or RF microneedling. The benefits of salmon DNA with either of these treatments: it helps with hydration in the skin, the healing process, and it gives you that glass skin appearance. Due to your body's immune system and healing process, it does take about 3 treatments to see your optimal results. We recommend the 3 treatments to be spaced out 4 to 6 weeks apart. This is definitely one of my top recommendations for anti-aging and the reduction of fine lines and wrinkles. Of course, another way to smooth fine lines and wrinkles is injectables. This is our newest treatment, so let's hear from Laura.
Thanks, Emily. Now I get to talk to you about Tox. And Lativo is one of our newest toxins on the market and here at Synergy. I'm Laura. I'm a certified aesthetic nurse specialist here at Synergy inside the Beltline. I have been with Synergy for about 2 years, and I have been a nurse for 13 going on 14 years. And today I'll be talking to you about Tox. Tox is botulinum toxin A, and what it does is it relaxes the muscle. So it goes into that synapse, to get really sciencey on you, and it stops the transmission from the acetylcholine into that synapse, so essentially stopping movement. But this isn't permanent. It lasts for about 3 to 4 months. Everybody's always a little different. Your muscles are not going to return to the same normal working function that they have in the past. Almost everybody can be a candidate for Botox. Really, we make sure that your medical history is clear. If there's anything suspicious or any concerns for any neurological issues, we're going to consult with your neurologist or primary care doctor, but everybody is pretty much a candidate for Botox. So there's lots of different areas that Botox can treat, all the way from the top of your head to your armpits and your feet. A lot of the times we're treating the upper face, your forehead wrinkles, your 11s, maybe your crow's feet. I like to treat the face because it's important as we age. It'll help with that pulling down, that jowling that we're getting. The chin, we can do the lips just to show a little bit more of your lip line, as well as your neck, your traps. So maybe you have some built up muscle there and it's achy or really tense. We can release that with Botox, as well as your masseters. We have 4 different options here at Synergy: Botox, Lativo, which is the newest Korean neuromodulator, Dysport, and Xeomin. All of them are the same exact molecule, which is botulinum toxin A. They're just made a little bit differently, and some of them have a different carrier protein around them. Botox starts working in about 3 to 5 days, fully kind of set in at 2 to 3 weeks, which is why we like to do our dose adjustments if we need to at that time, and then lasts 3 to 4 months. I'm here with our lovely patient Amanda, and we are going to go over all the different places that she has had Tox. She has been treated recently. When Amanda came in for her full face assessment initially, we had a discussion as to what some of her goals were. So she expressed that she wanted smoother looking skin and a little bit of a lift because she was experiencing some jowling. So when doing a full face assessment, I'm going to look at the patient's face as a whole. I'm going to look at the volume. I'm going to look at their wrinkles. I'm also going to take into consideration their skincare. So all those things being said, when I have the patient come in, I'm going to ask them where their eye goes to when they look at a photo or they look in the mirror. When a patient is more mature, you want to be careful for over-toxing an area in case it feels really heavy. There is less muscle, there's less movement. It depends how long the patient's been having tox. There's lots of different factors for us to take into consideration, which is why you come and seek an expert. So even as the patient comes in and they're sharing with me what their concerns are, I'm also taking it a step further to address areas that they may not be thinking about or have an idea that Botox can treat, such as the lower face, the neck, your traps, things like that. So Botox is a great tool in our toolbox to be able to use not only for smoothing wrinkles, but helping with muscle excess. So Amanda had a great first time Botox treatment, and we are going to show you her before and afters. So we're here with Becca, who is our next patient. She's in her 20s, and we're looking more towards the prejuvenation, prevention versus treatment of the static lines. So those lines that are etched in. Every patient is going to be different, every treatment plan is going to be different, and every aesthetic injector is going to have a different eye. It's going to be important though for you to come in for a full face assessment so that we can look at every aspect of your face. So when we spoke with Becca, we asked her what some of her areas of concern are or areas that she notices, and those areas were her forehead lines. So she can notice that she has dynamic wrinkles, so wrinkles with movement. And then she also talked about another area that we hadn't spoken about yet, which is your masseters. So that area can sometimes be tense due to TMJ, or we could be doing it just for facial slimming because maybe there's a bulkiness of tissue back here. So now we are going to mark up Becca and get her treated for her first tox injections. For Becca, we're going to be looking a little differently at her anatomy. We want to prevent things like jowling, but we also want to prevent creases in the middle of her forehead, as well as lifting her brows. We can really harmonize her whole face by doing a little bit of tox everywhere. So we talked about treating her forehead, but we also need to talk about treating her glabella, her 11s as well. So these muscles here work synergistically. So these muscles help to pull down and in, and if we relax them, they're going to lift up and give us a brighter look to our eyes, as well as prevent that forehead Botox from feeling heavy. So that's going to be an important balance that you should see your injector having that conversation with you. So another area that I would potentially treat in Becca is her frownies, and she has that pull down from the corners of her mouth. Now, sometimes at rest, people can have that and it just stays kind of stuck like that. All we need to do is put a little bit of tox in the side here, and that's going to just help to relax it and essentially lift up the lower face. So another area that Becca mentioned was her nose. When she smiles, her nose tends to curl down, and she doesn't really like that. Well, we have a solution. A couple units of Botox will actually help the nose to not pull and curl down. So we're relaxing that muscle that attaches there. Okay, for your post-care instructions, I want you to make sure you don't exercise for 24 hours. That includes no like heavy sweating, so don't go outside and sit at the beach, that sort of thing. Wait until tomorrow. You can go for a walk though. No rubbing your face for 4 hours. No hats or headbands that are tight. And then no laying down for 4 hours. You can recline back, just don't lay flat. Don't go have your brows done, all of those things. Do you have any questions? No? Okay. You could have a bruise. There's always a potential. I am sticking a needle into your tissue. I didn't see any areas of concern. If I did, I would have let you know though. but you can take arnica or bromelain, put arnica gel on there if you're concerned about a bruise. Vitamin K by Revision is one of my favorites. That is a great product to put on a lip filler bruise or even a little tox bruise. Thank you so much for tuning in to hear about one of our most popular treatments. It is a great anti-aging treatment for majority of people. We can't wait to get you in for a full face assessment.